Thank you for being with us for this very important COVID-19 virtual town hall meeting. I'm Ronnie Dahl.
And I'm Tyler Kieft. These are confusing times. For the past week, we have reached out to you, the public, in order to submit your questions for a panel of experts regarding the latest with the COVID-19 virus.
But Tyler, before we get to those questions and kick off this show, we also want to take a quick look back to how we even got here. It seems like it was so long ago, but it wasn't even a year ago. February 28th, that's when the alarm bells were sounded when Governor Whitmer announced the state activated its Emergency Operations Center. And then on March 10th, Michigan confirmed its first 2 COVID-19 cases, and that number quickly grew. To date, more than 577,000 people here in the state of Michigan have been diagnosed with COVID-19, and sadly, more than 15,000 have died.
Yeah, the new year brought new hope with the vaccine, however, Ronnie, and the state of Michigan has been making strides to make sure that the state's most vulnerable populations are being vaccinated, as well as frontline workers.
And so with that, December 11th, 2020, that is when the FDA issued its first emergency use authorization for a vaccine to prevent COVID-19, bringing hope to Americans. Since then, more than 1 million Michigan residents have received at least one dose of the COVID-19 vaccine. That's about 5.2% of qualified adults have been fully vaccinated here in the state of Michigan. But over the next 45 minutes, we hope to clear up the confusion as well as the misinformation surrounding the COVID-19 vaccine. We have put together a panel of experts with decades of knowledge and experience to help us and to guide us through all of this. And so with us today, Eric Wallis will be with us. He is the president at Henry Ford West Bloomfield Hospital. Also on our panel today, Dr. Manu Malhotra. He is the Chief Medical Officer for Henry Ford West Bloomfield and the Northwest Market. He's also an emergency physician. Dr. Chen will be with us. She's the Chief of Medicine at Henry Ford West Bloomfield and Program Director of the Infectious Disease Fellowship. Also with us today on the program, Dr. Russell Faust, the Medical Director for Oakland County. And we want to thank all of you for taking time to be with us. Dr. Faust, we know that you can only stay with us for a few minutes, so if we can go ahead and start with you. Thank you again for being with us.
Thank you for the invitation to join you all and be on your esteemed panel.
So, Dr. Faust, if you can just start us off, explain to us the county's involvement in the vaccine distribution.
You know, until recently, we weren't really a redistributor of vaccine. We were merely certified to administer vaccine. So we were receiving fairly small quantities, a few doses of vaccine, fewer than 2,000 doses per week. You know, we have the capacity to vaccinate between 20 and 30,000 people a week without really breaking a sweat. You know, what county health has done well in the past is mass vaccination. So we're prepared. We just need more vaccine.
So this really is a supply issue.
18,000 doses. I'm sorry?
So this really is a supply issue.
It really is a supply issue. But the good news is that supply is increasing. You know, that supply is gradually ramping up every week. And nationally, we're vaccinating something like 1.7 million people per day. So we're certainly on track for Biden's 100 million in 100 days.
That is going to be relief to so many people, but right now, trying to get the vaccine can be a bit confusing for people. I know they're in Oakland County. The county has started the Save Your Spot list. How is that working?
Well, it's working fairly well, given the limited doses of vaccine that we have. You know, the eligibility priority categorization comes down from federal to state, and we follow the state guidelines. Every county may be a little bit different, and every state is certainly different in how they're prioritizing those categories. But we're still kind of shockingly vaccinating folks in the 1A EMS group, that is the emergency medical services providers. But hopefully we'll be through them. There's an overlap now that we're into 1B, and school and child care staff and teachers, and those 65 and older, and police, firefighters, etc. So I can tell you this: there are around 400,000 people on the Save Your Spot list. I can tell you that it will certainly be fewer than that when we deduplicate. That is, many people are signing up multiple times thinking it's like a lottery, that will elevate their standing, and it doesn't work that way. In fact, we work off the very first form that's completed. So, signing up multiple times just adds time and complication to the folks that are working through the list.
Dr. Faust, that's great information just for the public to know, because your resources are valuable, and so don't bog down the system if you don't have to. And so with that, you touched on one thing is when it comes to the list, we are seeing that other hospitals have lists, Myers, some of the pharmacies now have lists. Should a person get on more than one list?
Absolutely. And there are folks that have that meet eligibility criteria right now, but we just don't have adequate vaccine to get to them on their position in the list. And the fact is, many have chronic diseases and they have multiple experts. Those experts have appointments, that is, privileges at the various healthcare systems. So really, they have the opportunity to sign up on more than one healthcare system, but also with Meijer, Rite Aid, CVS, Walgreens, and whenever they're offered, they need to go and get the vaccine.
I will say, Dr. Russell Faust with us here. Dr. Faust, I have to say, there was recently a vaccination clinic per se, a drive-through clinic at the West Bloomfield fire station. It was amazing to watch that in action. The coordination was so well orchestrated. Will you be doing more of those in the future?
I'm sorry, we're running multiple vaccination clinics every day, 7 days a week. So we're at least at one or two sites every day of the week, which is where I'm headed as soon as we're done here, is to help out at one of our vaccination clinics. I thank you for that comment. I will pass that on to our teams. They are a well-oiled machine now. They make us all look good. I think, I'll tell you what's frustrating there's still people out there that are hesitant with regard to being vaccinated. And I just don't get that. These mRNA vaccines are the safest vaccines in the history of vaccines. There's so many benefits to them. I'm looking forward to a time when our traditional vaccines are transitioned to mRNA vaccines. They're less expensive to produce, they're more rapid to produce, they have lower potential side effects with regard to egg proteins being in there and other allergies. I'm sure the other physicians on the call can comment to this, and hopefully they don't contradict me. But I'm a little bit frustrated by the hesitancy in some of the populations that we serve. No matter when you're offered the vaccine, you need to be vaccinated. It's the only way we're going to get to the end of this pandemic, is getting more shots and more arms.
So it really is all of us working together on this. And if I can go back to one point that you made, individuals signing up for multiple lists, if they are able to get a vaccine through one group, how do they go about removing their name from the list, such they're in Oakland County, so that they don't take up your time?
No, I appreciate that question. So they just need to go back to oaklandcountyvaccine.com. It's not vaccines.com, it's vaccine.com, and simply remove themselves from our list. And I appreciate them, making that effort, because it does allow us to make one less phone call to make that invitation when we get to them on the list.
Dr. Russell Faust with us, Medical Director of the Oakland County Health Division, joining us today on this COVID-19 vaccine town hall. And just for reference, we have received some questions from the public regarding additional COVID-19 vaccination sites in the West Bloomfield area. That is being coordinated between the township and the county, and the township is ready to help when help is needed and called for from the county. On that note, Dr. Faust, thank you for your time once again. I know that the county executive, Dave Coulter, is scheduled to give an update on the vaccination processes in Oakland County. That press conference will be at 10 o'clock this morning as well.
Can I make one more comment?
Absolutely.
Regardless of whether or not you get the vaccine, continue to mask, continue to distance, continue to avoid indoor gatherings. I need to emphasize this. Regardless of how many variants evolve, the masks work. Masking, distancing, avoiding gatherings will continue to work.
Well, we so thank you for your time. And one of the reasons we are doing this town hall is to try to clear up some of the confusion around the vaccine. And hopefully, after today, some members of the public will be a little bit more comfortable getting the vaccine after hearing from people such as yourself and our other panel of experts as well. So we so appreciate your time. And as you said, you're heading off to one of the clinics, very busy there. So again, we appreciate your time. And with that, we are going to go ahead and now, if we can, turn to our experts from Henry Ford. President Wallis, if I can maybe just start with you, how does vaccination distribution work at Henry Ford West Bloomfield? We have now heard from, Dr. Faust about how the process is working, there at the county level. How is it working on the hospital level?
Absolutely. Thanks for having us on. And I just want to say, we're really excited and very grateful to have great partners with the Oakland County Health Department. As I mentioned, one of the challenges that we've all had is getting enough vaccine supply to be able to vaccinate the people that we want to be able to vaccinate. So to date, as of yesterday, the Henry Ford Health System has vaccinated just over 105,000 people, and that includes our own team members. And we continue to do vaccinations at multiple mass vaccination sites kind of around Southeast Michigan. So here in Oakland County, our primary site is at our HAP building in Troy on Maple Road. Our health system has been kind of reaching out to eligible folks in a couple of different ways. So the first one is that we are using our MyChart app to reach out to our patients who are eligible and sending them out messages when they are eligible and when we have vaccine, that they have a ability to schedule an appointment. But we also know that there are folks in our community that don't have easy access to either MyChart or the internet. And so we are also looking for folks that we don't have an active MyChart account with or an active email address, and we're actually reaching out to some of those folks by phone. And so we're kind of trying to take this as a multi-pronged approach. I think, as Dr. Faust mentioned, that the major challenge we have is supply. Early on in the distribution, our health system was receiving 15 or so thousand vaccine doses a week. Over the last couple of weeks, that's been cut to 3,000 or 4,000 first dose vaccines. So we are very much looking forward to seeing production of vaccine ramp up. We're grateful that we've got partners not only with other health systems, with the county, but seeing the retail pharmacies jump into the business too. So, I would continue to stress what Dr. Faust stressed, which is put your name on every list there is. Because the sooner that we can get everybody vaccinated, it doesn't really matter whether you come to Henry Ford or go to Meijer, Walgreens, Kroger. What we're trying to all accomplish is getting shots in arms.
And so while we're talking about how to get the vaccine, supply has been an issue. So when you're trying to make these appointments, and the vaccines currently approved right now do require 2 doses, if you don't know how much you're getting every week, it's got to make it a little bit difficult to try to make those follow-up appointments.
Well, the one good thing that the state has done is they have separated first dose from second dose supply. And so we do actually each week receive both first dose vaccines and second dose vaccines. And to this point, they've been very good about covering, as they said they would. If we've given somebody a first dose vaccine, they're going to have a second dose for us. to give to that person. So we've not experienced at this point a shortage in those second dose supplies. So that's been great. And to date, we've not had to cancel any second dose appointments because of not having a supply to give to folks for that second dose.
That's good news there. And as we mentioned, obviously, there are 2 vaccines right now currently approved for use here in the United States, Pfizer and the Moderna. So what is the difference between the 2? That is what a lot of people are asking right now. Dr. Malhotra, do you want to go ahead and tackle that question?
Sure, yeah. I think the first thing to recognize is that both of them confer a pretty amazing amount of immunity. We're seeing efficacy at, around 95% after the second dose. So in that way, they're both very similar. The similarities are probably more than the differences between Pfizer and Moderna. If we end up talking about Johnson & Johnson, that's a slightly different sort of vaccine. But you're talking about neither one of these are live virus. So there's no live COVID virus. There's no risk of getting the infection from getting these vaccines. They're both mRNA vaccines, and we can talk about what that means. The symptoms are, side effects are very similar. They're a little bit more frequent than a flu vaccine, but maybe similar to a shingles vaccine for people who have had that. Both of these require 2 doses. One of them, Pfizer, is 3 weeks apart, and Moderna is 4 weeks apart. And as Eric was saying, we are making that second dose appointment as soon as you've completed your first dose. That's not a second line that people have to get into. And the state has been able to help us continue to respect those second appointments with consistency. One of the bigger differences between these 2 is that the Moderna vaccine doesn't require as low of a temperature for storage. That is a little bit more convenient, but both of them do require fairly significant cold, storage. And the reason for that is because the mRNA itself is just very, very unstable, and at temperatures above those freezing temperatures, the mRNA just breaks down, which is actually one of the reasons Dr. Faust was saying these are such safe vaccines, is because what's introduced into the body is just waiting to break down. So as soon as it does its job, it's quickly cleared away by the body. So, I think the side effects are very similar on these, and they both are very effective vaccines. And I think from the perspective of trying to choose, I think people should just be focused on getting whichever one they can get access to.
Well, and as you mentioned, so we have the 2 currently, but they do require temperature control. And so I wonder, as the vaccine is becoming more widely available at various places, the pharmacies, the drugstores, will that become an issue of the supply chain and them not being kept at the proper temperatures?
Well, I mean, that is an issue. That is one of the bigger logistical issues to address, and is one of the reasons that the initial distribution of Pfizer only went to very specific locations that could actually ensure that cold chain throughout the usage of the vaccines. And the Moderna has less cold requirements, and that's why that's been the one that's more readily been distributed to sort of smaller institutions that don't necessarily have the ability to provide those deep freezers.
So Dr. Chen, we'll get to you here briefly, but Dr. Malhotra, since you mentioned it, the Johnson & Johnson vaccine that is scheduled to be coming out, hopefully getting its approval this month. Kevin from Bloomfield Hills did email us, and he asked, he's waiting for the Johnson & Johnson vaccine because it is only going to require 1 shot, and it doesn't utilize messenger RNA. Would you recommend waiting for this vaccination?
I would not recommend waiting. I think that the actual key constraint is going to be how easily you can get in, where you are in the hierarchy of receiving this. If you're offered a vaccine, take it. The efficacy of the 1-dose Johnson & Johnson vaccine has not been shown to be as high as Moderna and Pfizer. there's definitely a problem of apples to apples comparison there. The testing that's been done on Johnson & Johnson is in an environment where we've got some variants out there that all of the vaccines are not as effective on. So I'm not saying that the Johnson & Johnson vaccine isn't a great vaccine. I mean, even with the, sort of 65 to 70% efficacy in preventing the disease, it does have 85% efficacy in preventing severe disease and 100% in preventing death over the 28 days that they actually tested it. So it's a very effective vaccine, but nothing to suggest that we should be waiting on that. Now, in the end, all of these are personal choices. If the difference between getting one shot or two shots is that significant, a person may choose however they wish to. But right now, the constraint is the volume of vaccine we have, and I would highly encourage anybody that has the ability to get to it to go ahead and get any vaccine that's offered to them.
Let's move on now to Dr. Chen. Dr. Chen, the next question comes from Marcia Kay in Keego Harbor. She asks, if you had a severe case of COVID-19, should you still get the vaccine? She also said that her brother was in the hospital with a case of COVID-19, just for reference.
Thank you. Yes, absolutely. Everyone should get the vaccine, and we should be doing everything possible to prevent infection, including masking, social distancing, and getting vaccinated. If you've had a prior case of COVID, it does not prevent you or preclude you from being reinfected in the future. And so that prior infection does not exclude you or lessen your need to continue all the masking as well as get vaccinated. And as Marcia pointed out, if someone was very ill, I think that's even more reason to try to prevent any future cases of COVID.
Dr. Chen, just to follow up with that, there may be some questions too. If someone has had the COVID-19 virus, they've recovered from it, and they get the vaccine, are they even more likely at that point, even less likely at that point, to be reinfected or to be susceptible to the virus if they have both those antibodies from beating COVID-19 and from being injected with one of the vaccinations?
Yes, well, thank you. And I wanted to add one more thing, which dovetails into what you're saying. I did mean to add, when you do get vaccinated after having COVID in the past, we do ask that you wait 90 days. So I did want to clarify that point. But yes, the CDC thinks that it's possible that for a couple short months, you may have decreased likelihood of getting COVID if you're infected. But our hope is that if you also get vaccinated, that will be a much longer effect of decreasing the effect of risk of getting COVID. So as you point out, if you also get the vaccine after being infected, your risk would be even lower than if you didn't get the vaccine.
Dr. Chen, thank you for joining us. Just on top of that, it was interesting you said that for those that have been infected, you're suggesting that they wait 90 days between doses of the vaccine. Any particular reason why it's that much longer of a wait? I mean, for most, I believe it's 28 days between the vaccinations in some cases, and this is significantly longer. Is there any medical reason behind why that is the case?
From our data worldwide, there were very, very few cases of people being reinfected with COVID within the first 90 days. So I believe that adds part of the decision-making that it is unlikely or less likely that you would be infected with COVID for those first 90 days.
Yeah, and I want to clarify what you said is that you wait 90 days for the first dose, not between doses.
Yes, thank you.
I have to say, we interview people at great length here on the show, and I am already learning so many new things today despite sitting in on so many interviews. So I want to say thank you again to all of you for helping us navigate this crazy world. And Dr. Malhotra, if we can go back to you for a second, because we did get a question from Taylor in West Bloomfield. He wants to know, how do we know the vaccines are going to be safe down the road?
Yeah, I mean, it's a good question, and the reality of it is we don't know with 100% certainty until we have long-term data. What we do know is that the risks of having the infection certainly comes with long-term side effects. So there are people who are having very, very extended and chronic symptoms from the infection. That's a current fact. there is a theoretical concern that there may be long-term impacts from this vaccine. There's no reason to believe that there would be. In fact, as I was describing earlier, the mRNA that's injected breaks down so quickly that there doesn't seem to be any reason to believe there should be long-term impacts. There's some theoretical concerns out there which will only be clearly delineated once we've had long-term data, but there's just nothing right now to suggest that there's going to be long-term impacts, and there's every reason to believe there's long-term impacts of the infection. So I think, as always, we're doing a risk-benefit analysis. Nobody's promising that there's no way that there's going to be any long-term effects, but the likelihood of that happening are extremely low.
Yeah, I would also add to Dr. Malhotra's answer, one of the things that we hear as concerns from folks is that that mRNA, it's new technology, or it's something that was developed so fast. The reality is mRNA technology has been around for decades. It's actually been used for quite some time in the treatment of oncology patients. And so while we don't necessarily have specific long-term data about mRNA vaccines and their long-term effects, we have a lot of data that shows us that it's been very safe for our oncology patients and some of the treatments that we use to treat cancer. And so that leads to some of our confidence around the fact that these vaccines will be very safe.
Dr. Chen, let's go back to you for just a minute. What about women who are pregnant or are nursing? Laurel in Waterford is 7 months pregnant. She wants to know, is it okay for her still to get the vaccine?
There's a lot of great questions about pregnancy and safety. So people who are pregnant and who are part of a group recommended to receive the COVID vaccine at this early stage, such as healthcare personnel, may choose to be vaccinated. A conversation between a pregnant patient and their clinician may be helpful to help them decide whether to get vaccinated. This is authorized, the vaccine, by the FDA for pregnant women by emergency use authorization, which means available now for everyone, including pregnant women. While a conversation with your healthcare professional may help you in making that decision, it is not required. So you may sign up to get the vaccine if you qualify right now through your other risk factors. The three key considerations I would say in making your decision if you're pregnant is thinking about and discussing with your healthcare provider your risk or likelihood of exposure to COVID, as well as your risks of COVID to yourself and to potentially to your fetus, and what that may result in. And then as well as knowing the side effects of the vaccine. And there is limited data at this time during pregnancy, but everything we have suggests that it should be safe. And more data is being collected as we speak. So hopefully as the vaccine is available to everyone in the United States later this year, we will have more data to safely reassure everyone that what we think to be true, that this should be safe for pregnant women, is true.
So, Dr. Chen, I would think it's the same thing if a mother is nursing as well. It's okay for them to get the vaccine.
Yes, I think that they should have a conversation with their physician. There are not any data to suggest that the effects of the mRNA vaccine would have any negative effects on the child that's breastfeeding. But again, that would be a decision made by the mother and their healthcare provider.
Dr. Chen, we are hearing so much more now about COVID-19 variants. There's been now a few of them that we know specifically about, and now we're hearing some information about their relationships to these COVID-19 vaccinations that are available. Will these vaccines work on some or all of the variants, and is there a relationship between certain vaccines to certain variants and their effectiveness?
That's a great question. And I saw last night there was even a report of some data with one of the vaccines and one of the variant strains. So what I would say is every variant strain is different. And we don't know, but as more data is coming out, we are finding out how much efficacy the vaccines have against the variant strains. We know that the CDC asks that we protect ourselves and assume that we can get infected with the same strain or a new strain. And in addressing the specific question about vaccine effectiveness against the new strains, it's simply too early to know. But in all cases, we think that getting vaccinated will have some effect. It will be of some help. So there's no reason to wait. I think many experts feel that we're seeing so many variant strains emerge, and we do anticipate the virus to continually mutate in the future. I wouldn't be surprised if this vaccination effort becomes something similar to the flu vaccination, where it may be possible that we may need a vaccine every year to adapt, our immunity to the changing strains. So short answer is it's a little bit too soon to tell, but we're hopeful that even if it's not quite as effective to the variant strains, we will still have some protection in some cases.
So we are hearing so much right now about the term herd immunity. Never heard it before the crisis. Since then, it has been tossed around pretty consistently. So maybe this might be a good question for Dr. Malhotra. What exactly is herd immunity? And with that, how does getting vaccinated play into actually reaching that herd immunity level that we hear so much about?
Yeah, from the public health standpoint, this is a pretty relevant concept. The general idea of herd immunity is that if enough people in a population are protected from a disease, then that disease will have a very hard time catching hold and traveling within that population. So if you imagine a disease where one person will infect 3 people around them, then those people will affect 3 around them. You can see how something like that can really snowball. If that person is surrounded by people who are immune to that disease, suddenly that chain reaction stops right there. You don't get 3 people infected who will then infect another 3 people. And the result of that is another person who is not actually vaccinated or not protected, who's further in the herd, is protected because of all these people in between who will not actually be passing on this infection. So, that's the idea, is to decrease the likelihood that infection will catch hold. And it won't mean that there wouldn't be cases sporadically here and there, but it'll stop things from becoming epidemic or pandemic, because it just really, really constrains how quickly something can spread. So, depends on the infectivity of the virus that you're talking about and what percentage of the population is actually getting vaccinated. But some early estimates were that, if we were around 70+% of the population being vaccinated and protected, that maybe we would be at the level of herd immunity. There's some revisions to that number saying that maybe it needs to be a little bit higher, but there is a certain level. You don't have to immunize 100% of the people in a population to start getting rid of these problems. And what you'll have is sporadic cases here and there that will just sort of die out without spreading. So that's the idea of herd immunity.
It is a fascinating concept to regular people such as myself, because we go on to see and think, well, eventually someone's going to get it, and won't it start the pandemic over again? But really, it's the vaccine that stops it from spreading.
Well, yeah, what happens is somebody will get it, and then they'll be, infectious for, let's say 7 to 10 to 14 days. But during that time, all the people they interacted with are already immune to this. So it just doesn't catch hold. And that's the intent. So to not let it get into this chain reaction of getting passed around.
So fascinating information to me, and I'm guilty of watching some of these documentaries on Netflix, and you see how it spreads, and people have been saying that this was a possibility to happen for years, infectious disease experts, and here we are living with it. But we're learning something new every single day. President Wallis, if I can come back to you for just a quick minute here, when it comes to signing up for the vaccine, there are some people that kind of fall into various categories, kind of in between the cracks. So we had a question from one person. They are under 65, yet they do have underlying health issues. So for people such as them, what is the best way for them to be able to try to navigate how to get the vaccine? Is that going to be determined through their doctor?
Yeah, it's a great question. And where we are right now, I think, and Dr. Faust alluded to it, is, the state laid out several kind of categories. Group 1A that included direct healthcare workers and a number of essential workers. Group 1B, which also included another group of essential workers, and then started talking about patients over the age of 65 specifically. And then what you're talking about really is Group 1C, which is those folks under the age of 65 that have underlying health conditions that may put them at risk. And so it's not a perfect strategy. It's not a perfect stratification of society. And so it's not going to catch every single individual, exactly where they think that they should be or where their risk says that they should be. And so again, I think the best advice that we can give to folks is put your name on as many lists as you can. I think even as you look at the apps from Meijer, Walgreens, Kroger, some of the retail pharmacies, the Oakland County site. It does ask questions about what your risk factors are, what your age is, and we as providers throughout the community, as we give vaccine, we're using those self-reports as guidelines to help us tell us when it's your time. So certainly, again, I think that the message overall is because the distribution of vaccine is widespread to a lot of different entities. You really want to have your name on each one of those lists, and you may come up faster on one list than you do on another. And so that's why it's so important not to just put all your eggs in one basket, so to speak.
President Eric Wallis of Henry Ford West Bloomfield Hospital joining us on this COVID-19 vaccine town hall on Civic Center TV, Lakes FM, and a number of other community outlets. And Eric, a lot of people are concerned about communication and being able to get on these lists because so much of it is online. For especially older, less tech-savvy populations, who can they contact or how can they contact people to get on these lists, whether it be through one of their local health systems, their primary care provider, the county, and et cetera?
Yeah, I think each health system not only has recognized that there are folks who don't have access to email, don't have access to a computer on a regular basis, or just don't normally use that technology. And so what we've done, and I'll speak primarily for the Henry Ford Health System, is that we do have a team of folks who is regularly reaching out and calling some of that at-risk population to see if once we have vaccine and appointments available, to try to get some of those folks scheduled as well. I think the important message there would be, again, to reach out. Almost every person who's doing vaccination has a telephone number or a contact line where you can reach out and try to get your name on their list as well. I would continue to drive folks to our website, which is henryford.com. There's a COVID-19 page there that does explain a lot of the information that we talked about today, and also talks about how and where you can get your name on the list too. So it's important to look for those resources, but we are actively reaching out to some folks via phone if that's the only way that we have to contact them.
So is it okay for a loved one to try to sign up? Like if they have an elderly parent, can they sign them up?
Yeah, absolutely. We've seen multiple instances of folks that have put their parents' names on the list. Again, I think that's all good. It's this is going to be kind of very much a team effort as we go forward. We've talked about partnership between health systems in the county and health systems in retail pharmacy, et cetera. And so again, I think if you've got someone in your life who is in one of those at-risk categories and doesn't have access to the internet or to electronic means of getting their name on a list, helping them, it makes all the sense in the world.
On top of that, and we've received some questions as well from people in the community regarding transportation to vaccination sites. Not everybody in the Oakland County area, in West Bloomfield Township, or the surrounding areas has access to a personal vehicle or can rely on public transportation. In West Bloomfield specifically, West Bloomfield Parks is providing some transportation to vaccination sites. The residents 55 and older or 16 years and older with disabilities that are properly documented can get rides to and from medical appointments for $2 a ride. For more information on that, you can go to the Parks website. I'll pull a graphic up here for us real quick, or call 248-706-2411. That is 248-706-2411. And Eric, again, in the case of Henry Ford West Bloomfield Hospital, if people have questions about about signing up for vaccinations through Henry Ford Health System, who can they contact?
Yeah, again, I would drive folks to our website, henryford.com. And right on the main page there's an entire section about COVID-19 that has a lot of information about where to go, how to get your name on the list, how we're reaching out to folks, how to sign up for a MyChart account if you don't already have one, because that's a great way that we're reaching out and notifying folks as well. So a lot of great information there, and just to really encourage folks to go to henryford.com.
One last question, if you all can pull out your crystal balls here for us. The most important question of the day, when are we going to be able to stop wearing masks and get back to a normal life? Anyone want to tackle that one?
I'll start us off and then rely on my expert friends. I think the reality is we don't know yet, and that as Dr. Malhotra so greatly described, getting to that place where we have herd immunity or 70 plus 80+% of our folks vaccinated before we get there. I think one of the interesting side effects about the process of wearing masks and being socially distant, people being focused on washing their hands, is that I will speak again for the Henry Ford system. We've seen exactly one case of flu this entire flu season to this point. So it really does work. It works for more than just COVID-19. But I think the question is going to be, what is normal on the other side of this, and what does it look like? I think we can expect that it won't look exactly like it did before the pandemic. So it's going to be a little while. The sooner and the more that we are able to vaccinate folks, the more that people sign up to be vaccinated, the sooner we'll be able to get back to whatever that new normal looks like.
What I'd like to add is we all want to get back to, quote, normal, and the faster we can do that is by social distancing for now, masking all the time when we leave the household, and everyone trying to get vaccinated. And if we can all do that, then we're going to reach the goal faster. And this, as people are reluctant to do those things, we're just going to slow down that finish line, and we're never going to cross it. So we all need to do our part.
I'll just add one more comment to that, which is to say that instead of focusing on when will things be back to normal, I think what we should really be focused on is to say, how can we safely find the right way to engage with our friends and our loved ones? And I think people will recall last summer when they were able to have outdoor socially distant barbecues and interact with each other, that it didn't actually seem all that oppressive. And then we sort of came into the winter, outdoor activities went away. The cases went up a little bit, and a lot more rules and regulations came into place. I think that there are a lot of very, very healthy ways to interact that won't seem as oppressive even as we're going through this, and to focus on that and to be able to interact with each other in a safe manner, but make sure that we're still focusing on those relationships, whether it's on Zoom, whether it's in socially distanced outdoor venues as the weather improves. I think things are going to get a lot better soon. They may not look exactly the same as they did maybe for a while, but maybe that isn't the thing to focus on, but just to take incremental steps towards normalcy.
I'm a hugger. I miss people. I miss talking to people, especially strangers, those organic conversations that you just, you spark in line to get a coffee or in line for a Tigers game. Are we ever, let's say in the next 2 years, will we be able to go back to a big stadium?
I'm an optimist, so I think yes. I think well. I think if things go in the direction that they're going, the next 2 years is a decent timeline to be able to reach some of these milestones that we've been talking about. And, will they be as crowded as they used to be? I don't know the answer to that, but I think that you're going to see something that looks very similar, if all goes as expected, optimistically.
Well, you know what? About 2 years, that should give the Lions enough time to rebuild their team and make it to the playoffs or the Super Bowl for all of us to get together in person and to enjoy that.
Really enough
That would make you an optimist, Ronnie.
Exactly. So we do want to say thank you to all of you for taking time out of your day to be with us, and very important information. And of course, thank you to Dr. Faust for taking time out of his day. We so appreciate your knowledge, but also your expertise. I think we all feel a little bit better coming out of this crisis, just hearing from you and sharing your knowledge, because these are confusing times for all of us 11 months into the pandemic. So thank you so much. We want to say also thank you to all of our sponsors and our community support system as well to help us put on today's show. For everyone out there, stay safe, stay healthy. We will get through this together.